So the way to actually discover where these landmarks are is to actually look at someone's ear. So we have a nice volunteer here. Katie has been willing to come in for us to be able to use an ear that we can look at and see where points you could see on slides actually need to be shown on 3 dimensions of the actual ear. So one handy tool that one should have in doing this kind of ear work for a lot of people who have longer hair is an ear clip. It can be found in obviously most stores. And as you look at the ear, you'll be finding out that we can have certain devices, like this probe here, is really good for finding out where there are little notches in the ear. And then also use some other probes that we can use actually for treatment for doing acupressure. But right now I'm using to find the ear. So if one takes this kind of probe, one notices that the area that we're calling landmarks here, actually you can see how it catches right here. So we have this region that goes across the concha, called the concha ridge, and then it rises up to become this area we call the helix. Right where the two meet is this little notch. So we begin by making that the 0 center of the whole ear. Then as we rise above there, this next landmark region, well, I might say it's right here. It's not a specific spot, as was true of, say, this landmark 0 here. So this first landmark is an interesting area where the ear, which is still on the helix, crosses over, and you see on the underside, this ridge we call the inferior crus meets right on top of that. So it's where, kind of where people would put their glasses like that. That's the spot. Now we use these landmarks to find other points. So right now I'm just pointing out how they are visible in this respect. If you go to the very apex or top of the ear, you might notice if you could actually bend the ear like that. So all this is referencing the second landmark, or actually this is really 3. We got 0, 1, and 2. This just sort of guides you into knowing, okay, so here's what we're going to call the very topmost point of the ear. Then as you curve around, there's landmarks that relate to what's called Darwin's tubercle, actually named and related to the famous evolutionary theorist discoverer, but he discovered many other things too. Now, on her ear, it actually isn't that prominent. But what you can do is feel that there's a crevice where this section of the ear is actually like there's a little break in the cartilage from this lower section. So right about here, there would be what we're going to call landmarks 3 and 4. And they divide this top region of the ear from this outermost region. Coming down, we come to where the ear helix, this outer ridge, comes down and right about here starts to curves a little bit more, and it becomes the soft, fleshy earlobe. So we have this second set of landmarks right in here. And then at the very bottom of the earlobe, just to distinguish, it's the bottom. There will be this landmark that I've titled Landmark 8. And curving around even more is where the earlobe joins the face or the jaw. And that landmark hits right there. We have a landmark here where we call the intertrachic notch, this tragus and an antitragus. And then on the tragus itself, on this flap that's over the ear canal, we have 2 little knobs. And actually, one can feel them with one's finger, but with a probe like this, you can really see how they've come out as far as a sense of touch. There's a little knob here that kind of comes in again, and a little knob here. And again, why do we point this out? Because there will be points we use relative to these landmarks. Coming down in this region, we have this antitragus ridge. So this was tragus, this is antitragus, and we can see a little notch or knob or bump right there, and another one right there. Just like we have these 2 little bumps on the tragus, we have these 2 little bumps on the antitragus. Now, how is that useful? Well, we can start with dividing up the head. This antitragus region will come to represent where you treat heads for, like, most commonly, say, a headache. And this little bump here distinguishes the more forehead region. And from here to here, it would distinguish more the temple. And more from here to here would distinguish more the occiput, or back of the head. Then there is a little crevice that joins or separates the antitragus from the antihelix. When you use this kind of device, or you could just use your fingernail if that's obviously more available, when you have a device like this, you can see, all right, there's a little notch I can identify here, and the ear antihelix starts to rise. And then it comes a point where really it doesn't continue in this direction anymore. It just sort of catches. So there's sort of an angle there. And then we have to come back this way. And then it catches another little notch. So there's a little notch here with a little bump on top of it. That's at the tail of the antihelix. There's this big, long region here, which is the antihelix tail. There's this landmark here. This is landmark 14. This is landmark 15. Curving around further, we hit another little landmark. This is the body of the antihelix. And then finally, we have this last little mark on the side here. And this becomes the inferior crus, the lower arm of the antitragus. There's a very little notch there. And then on the top side of the antitragus, about halfway along, there's this final crevice. Now, this crevice has been very intriguing in the history of auricular acupuncture, because Paul Noget, who is basically the father of auriculotherapy, in the sense that he discovered this system, he had first noticed this point that divides this innermost region of this inferior crus from this outermost region, and he found it was useful for the treatment of sciatica pain. So we call this the sciatica point. So it's a landmark, and it's also a point that we use for treatment. Just as point 0 is a landmark, that's also a point we use for treatment. So using those landmarks is a good way to begin how to understand the ear. All right, how'd that go?